Thanks for being with Morning Live. Now, this morning we are catching up with the Solidarity Fund and what they've been doing. Now, established by President Cyril Ramaphosa in March this year, the Solidarity Fund has to date received more than 3 billion rand in pledges and partnerships. The money has come through the support of over 300,000 donors, comprising of both organizations and individuals. And according to the fund managers, almost 2.5 billion rand has been approved for health response initiatives. Now, a sum of 411 million rand has been disbursed for humanitarian needs such as food relief, while 56 million rand is used for advocacy and messaging for behavioural change as the country is going through the COVID-19 crisis. And joining us now is Solidarity Fund's Chief Executive Officer, Nomkhita Nqweni. Thanks so much for joining us and welcome to Morning Live.
Good morning, and thank you very much for having me.
Let's start for the benefit of all watching and listening to this interview by speaking to the mandate of the Solidarity Fund.
Well, thank you. I think you've done the introduction very well. And I think one of the things that I'd like to highlight is that the fund is, in fact, an independent public benefit organization that effectively was initiated by a combination of government, a business, and civil society. And effectively, the mandate of the fund was to really be a short-term crisis intervention fund to augment the country's response to the COVID-19 pandemic. And as you've alluded to in your introduction, our focus areas have largely been in the areas of the health response, which is largely where we've spent the large part of our resources because this has been a health-related pandemic. And we've also focused on the resultant humanitarian, crisis that has come about with lockdown, and also importantly, creating awareness, because I think it's quite important that behavioral change in the long term is going to be the only way that we can be able to fight this pandemic. So those are the areas that the fund has focused on in terms of our work.
So in the main, where has the funding come from? And if you could just give us a breakdown, Nomkhita, of just broadly in broad brushstrokes, exactly where the funding was derived from in terms of private and public monies that were received.
Thank you. You were quite accurate again in your introduction, because the fund has really been a collective effort of all South Africans. And when I say all South Africans, I mean all stakeholders. And so if I were to give you a breakdown of where the donations have come from, just over 300,000 individuals have donated to the fund, either directly through direct donations on our portal website, or through affinity partnerships. So, for example, if you're at a ShopRite and you are checking out and as you are paid, then you donate 50 Rand, 200 Rand towards the Solidarity Fund. And also more than 2,800 corporates and trusts and foundations have actually donated. We also have received donations from political parties. Some of the political parties have actually donated to the fund. And also, finally, given that the president role modeled payroll giving and sacrificing a third of his salary and contributing to the fund for 3 months, we saw a lot of companies, individuals, and actually boards of corporates also following suit. So that has been the streams of where donations have come from the fund. And really, we always like to say that the generosity of South Africans and the role modeling that they have showed that in times of crisis, we indeed can come together and work together in a very, very progressive way.
So, in terms of oversight, where does the oversight responsibility lie in terms of how the funds are actually dispersed?
Thank you. So, as I mentioned, the fund is an independent fund, and it has been registered as a not-for-profit organization because we had to register it for us to be able to conduct all of our work. At the outset of the fund, there was a governance structure that was put in place. There is a board that is chaired by Mayor Gloria Sirome, and that board has got 3 sub-board committee structures that really assist us in providing the oversight and rigor to the work that is being done in the fund, through an audit risk committee structure, through a disbursement subcommittee structure, where effectively we have the oversight of board members in how the funds are actually deployed, and lastly the donations subcommittee. And all of those subcommittees are actually supported by not only the management teams that effectively are working for the fund on a pro bono basis, but also supported by technical advisory bodies that are comprised of technical experts in the health sector, for example, in the context of the health response, and also in the humanitarian effort, drawn from the large pools of civil society, the likes of the UN, etc., serving as technical advisory panels that really are the first kind of line in really distilling the proposals and the decisions that are then recommended to the board and ultimately lead to disbursements. So that is how the whole structure and the process works.
So just on a point of clarity, Nomkhita, does this mean that the Solidarity Fund is an NPO in effect?
Correct, it is. We have to register as a not-for-profit organization, correct.
So in that regard, is there no provision for Parliament to have some form of oversight given the composition of the fund?
So we do have Parliament. We consider Parliament and Cabinet as part of our stakeholders, as we do all of our donors. And when you say oversight, I take it in the context of, having a keen interest in the activities of the fund, and that we are accountable and report to them. And certainly we do that.
So in terms of reporting to ordinary South Africans who are also making contributions, because one of the things that we were told the Solidarity Fund would do would be that it would be transparent, and one would have expected regular updates, dashboards where you can actually see what is going on with the fund. Are you actually doing that?
Well, this whole notion of transparency and the perceived lack of transparency from the fund is actually quite an interesting conversation. But nonetheless, we always welcome feedback, because it can always help us to do better. But if I can paint a picture of how we have lived up to what is a very important principle for us, which is exactly transparency and reporting back to all of our stakeholders, including ordinary South Africans. Since the inception of the fund, and the fund is now 5 months old, we have held at least 5 press briefings. So on average, that would be just, over just 1 press briefing a month since this, the fund has started, on platforms such as this one, where we have had live streams of all of our updates, particularly post our board meetings, to enable all of South Africans to access information and understand what it is that the fund is doing. In addition to that, we issue weekly updates. There are weekly updates that are issued and are posted on our website and our social media platforms. And finally, whenever the fund is making decisions on disbursements, so for example, supporting testing through the NHLS, supporting the local manufacturing of ventilators, we have actually issued press statements and updates, and we continue to have platforms and engage on platforms such as this one, on interviews, radio, etc. On our website, which is really the window to a lot of our activities, all of what you are talking about, which is the dashboards, reports on some of the completed aspects of our work, they are all there. So we are trying very hard to ensure that we live up to our principle and value of transparency and accountability.
So could you please give us examples and perhaps scenarios of typical cases that actually get approval from the fund? And what is the criteria that's used to identify and prioritize cases for funding?
So as I mentioned, the three pillars of the fund. Firstly, it's to say that the fund is not a grant-making organization. We're not a grant-making organization, so we don't necessarily receive, let's call it, external proposals, let's call it from the broader sector. We agreed to focus on the three key pillars, and I'll tell you how we have worked within those three key pillars. The first one being health. So if I can detail exactly what it is and how it is that we have prioritized the areas of our intervention. As I mentioned before, we have worked extensively with technical experts, the likes of Prof. Salim Karim, the likes of Glenda Gray, and working with the National Department of Health in really understanding what the priorities would be for the health response, and therefore what our interventions as the fund could be to support the country's efforts towards COVID-19. And those engagements led to prioritization being in the following areas. The first area was, very importantly, in the first phases of the pandemic, the protection of frontline healthcare workers. And therefore, in receiving a proposal from the National Department of Health with respect to what support that they needed, we then activated an intervention in securing the procurement of PPEs that are distributed into hospitals across all of the provinces. So that was one priority area. The second priority area was, especially again in the initial phase, around testing. You will recall that we had challenges with testing capacity, we had backlogs, and so we supported the NHLS for the NHLS to be able to procure additional testing kits. So through the 250 million investment that we made, the NHLS was able to support more than 1.2 million additional testing reagent kits that they would have been able to secure. And also because the NHLS was, I suppose, experiencing backlogs in terms of capacity, we then invested in academic laboratories, activating the functionality of academic laboratories to be able to support the testing capacity for the NHLS. The third area of priority was identified to be, as the pandemic was reaching its peak effectively, and we saw more and more people being hospitalized, the key, one of the key requirements was ventilation. And so the fund, through the National Ventilator Project, actually invested in the local manufacturing of what is called non-invasive ventilators through the CSIR and a consortium called SABC. And those ventilators have actually started being distributed and being used. And so I detail all of these examples because I think it's important to create the understanding that a lot of our work has been focused around being clear as to what is prioritized and needed at a particular point in time. We have also been wanting to ensure that our efforts are actually off scale, so they can actually be a broad and big impact in terms of what it is that we embark upon, and that can clearly show and make a difference. If I may just also make examples in the humanitarian space, the two focus areas that we have focused on in that regard has really been around food security, supporting families who were destitute, particularly during the time of a lockdown. And we distributed about 280,000 food parcels to families during the initial lockdown period. And at the moment, we are distributing 135,000 vouchers, food vouchers, again, to families. And the next area, again, through partnerships with civil society and groups that are active in this space, has been a response and support around the increasing gender-based violence scourge that we are seeing. And so the areas of work and how we have, I suppose, made decisions has really been a function of collaboration, a function of partnership, a function of leveraging the technical expertise of various groupings that are interested stakeholders, that we could ensure that the right priorities and the right actions are actually being done.
You haven't escaped criticism, though, and one of the issues, of course, that the Auditor General highlighted that we have been seeing in the public domain more broadly is, of course, corruption around COVID-19 funds, and this has always been a key worry. And you explained to us, you know, some of your priority areas in terms of where you've been spending money, but there has been great criticism about the 3.3 million rand that you have spent on branding motor vehicles. Talk to us about that and explain to us the rationale behind that when, of course, people are really starving out there, people are struggling. And if this is about the messaging, why did you believe that this was the best way to bring the messaging across?
So, as I mentioned, that part of the important work that we needed to do was to create awareness and ensure that the messages of how we need to augment our behaviors and comply to the behaviors of staying at home, wearing our masks, and so on, is important. And to do that, you need to be able to ensure that you are communicating to all stakeholders accordingly. Now, one of the stakeholder groups that we have been working with is actually traditional leaders. In the rural areas, the format that is used to communicate largely, especially in the rural villages, is what they actually call loud hailing. And in fact, the investment of 3.3 million rand was to procure loud hailers, not brand vehicles. The branding of vehicles is just what we did to, just try to profile that this is as a result of the Solidarity Fund. So there's actually no money that went into branding of vehicles, but rather we wanted to ensure that the loud hailers that sit on top of the vehicle, so that somebody's driving and they can make announcements as they are driving through the village, enforcing these messages, that they are branded and that those people in the villages are aware that these messages and the support is being brought to them by the Solidarity Fund. So I think it's quite important to make that distinction. It was for loud hailers that are a tool of communication in rural areas.
So you spent absolutely nothing, 0 rands on the branding of vehicles in this instance for traditional leaders?
The branding is for the branding of the loud hailers that sit on top of vehicles.
Not the vehicles themselves.
In some instances, what they did is that because they received the package of the loud hailer and then they received the sticker that is meant to go on the loud hailer, then some of them decide to put the sticker on the side of the vehicle instead of on the loud hailer. That is really the essence of what has happened.
So how much did that cost? Because you speak here about rural communities and they are obviously desperately poor in most instances. Surely that money could have gone to better use, don't you think?
I actually think that the best investment that the country can make at this particular point in time, especially as we deleverage to levels of lockdown level 2, and what we actually saw as behaviors around gatherings, funerals, etc., that we needed to invest in the ability to be able to reinforce and communicate the messages. And so I think that it is an important investment, because you do need to continue to create the platforms for communication and the reinforcement of behavioural change. And yes, I think we have tried to ensure that we are pretty balanced in terms of how we ensure that we provide our support. As I mentioned...
Nomkhita, I want to come back to the rural community. and the poverty levels, the need that exists in those communities. And I'm saying to you, I'm asking you, do you think, and especially now with the benefit of hindsight, that that was a good way to spend 3.3 million rand, given that you could have put money in people's hands, you could have given them other relief instead of spending that on stickers, as you say, for branding purposes. Surely that is, and I also want to put this to you as we wrap, so you can factor this in as well. What are the key indicators for you as the Solidarity Fund to measure the success of the fund? What sort of assessments have you done to make sure that you have actually been successful in spending the money adequately so far?
So I do want to address this notion of, support, particularly for rural areas. We actually have supported and put money and food on the table of South Africans based on the generosity of all of those that have donated. As I mentioned before, there were 280,000 food parcels that were delivered to families across the country, and largely in the rural areas particularly, that were part of those beneficiaries. And the value of those food parcels was about 600 rand per family. And at the moment, as I mentioned, we are distributing food vouchers that are valued at 700 rand to 135,000 families. And so, in a sense, we are exactly doing what it is that you are challenging us. We are doing as best as we can to actually support families in this time of crisis. And what are our KPIs and what are our measurement principles? It really has to be about what is the maximum reach and impact that we have had. For example, on the humanitarian side, we'd like to have, by the time we have finished our work as a fund, hopefully have reached and supported just about 1 million families through this crisis. And I also think that it's quite important to understand that the work of the fund is multi-pronged. So all of the initiatives that we are activating and are working on are multi-pronged. And so as important as it is for us to ensure that we support putting food on the table to destitute families, is also quite important to ensure that we continue to reinforce and educate as well, and use various platforms and channels to be able to do that.
Unfortunately, that's all the time we have this morning. Nomkhita Nqweni, thanks so much for speaking to us, CEO of the Solidarity Fund, talking to us about how the Solidarity Fund works and also how the money has been spent to date. And obviously, we need many more conversations around this, much more accountability and transparency needed, not just with the Solidarity Fund, but all the funding around COVID-19. A lot of money has been pledged. A lot of money has actually been ring-fenced for COVID-19 relief, but has it actually reached the intended, and also has it been spent correctly? So we'll keep our eye on this. It's time now for news with Leanne.